Pathophysiology of Mitral Stenosis. How did MS occur?
Rheumatic fever is the leading cause of mitral stenosis worldwide. The condition develops after a streptococcal throat infection, causing an immune response that leads to inflammation and scarring of the mitral valve, eventually narrowing it.
Why 40-year-old age?
Rheumatic mitral stenosis is typically a slowly progressive disease, and symptoms may appear decades after the initial streptococcal infection.
Why Indian?
India has a high prevalence of rheumatic fever due to poor sanitation and limited access to timely medical care in some regions.
Why lady?
Studies have shown that women are more prone to rheumatic heart disease than men, possibly due to immune system differences or hormonal factors that make women more susceptible to autoimmune reactions triggered by streptococcal infections.
Why easy fatigability?
Mitral stenosis causes reduced stroke volume, causes decreased cardiac output, causes insufficient oxygen delivery to tissues and organs, causes fatigue.
Why dyspnea?
Mitral stenosis increases LA pressure. This pressure is transmitted to the pulmonary veins, causing pulmonary congestion. This impairs gas exchange in the lungs, reducing oxygen uptake and dyspnea.
Why orthopnea?
In supine position, venous return increases, which further raises left atrial pressure. This pressure is transmitted to the pulmonary circulation, causing pulmonary congestion and dyspnea.
Why paroxysmal nocturnal dyspnea?
During sleep, fluid that has accumulated in the legs and abdomen is reabsorbed into the bloodstream. This increases venous return to the heart, further increasing left atrial pressure. The increased left atrial pressure is transmitted to the pulmonary veins, exacerbating pulmonary congestion.
Why hemoptysis?
MS increases left atrial and pulmonary veins pressure. The elevated pressure causes rupture of small pulmonary capillaries, leading to bleeding in the lungs. Blood leaks into the alveoli, and as the patient coughs, blood is expectorated, hemoptysis.
Why legs edema?
Long-standing pulmonary hypertension caused by mitral stenosis leads to right-sided heart failure. Right ventricular failure results in elevated venous pressure in the systemic circulation. And that causes fluid to leak out from the capillaries into the surrounding tissues. Peripheral edema.
Why diastolic rumble?
In diastolic phase, blood rapidly fills the LV through the narrow valve. It produces a diastolic murmur.
Why opening snap?
The opening snap occurs due to the sudden opening of the stiff mitral valve.
Why atrial fibrillation?
Mitral stenosis leads to left atrial dilation due to the elevated pressure in the left atrium. The enlarged left atrium causes disruption in normal electrical conduction pathways within the atrium. This results in irregular electrical activity and atrial fibrillation.